Hello everyone. Today, we're going to explore a medication called Glatiramer acetate, commonly known by its brand name, Copaxone. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Glatiramer acetate, marketed under the brand name Copaxone, is an injectable medication used to treat multiple sclerosis, MS. This drug falls under the category of immunomodulators, which means it helps to modify the immune system's response. Glatiramer acetate was approved by the FDA in 1996 and is specifically prescribed for individuals with relapsing forms of MS, including clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease. The primary function of Glatiramer acetate is to reduce the frequency of relapses and slow the progression of disability in MS patients. By doing so, it helps manage the symptoms and improves the quality of life for those affected by this chronic condition. Warnings: While Glatiramer acetate is generally well tolerated, it does come with some warnings. It is not recommended for use in individuals who are allergic to mannitol or Glatiramer acetate. Patients with a history of heart disease should use this medication with caution as it may cause side effects that can mimic a heart attack, such as chest pain. It is also important to be aware of potential injection site reactions, which can include pain, redness, swelling, or a lump at the injection site. Some patients may experience a post-injection reaction characterized by flushing, chest pain, palpitations, anxiety, and difficulty breathing. Although these symptoms usually resolve on their own, it is important to seek medical attention if they persist. Before taking this medicine. Before starting Glatiramer acetate, several factors need consideration. It is essential to inform your healthcare provider if you are allergic to the drug or any of its components. Given its impact on the immune system, individuals with immune system disorders or infections should discuss potential risks and benefits with their doctor. If you are pregnant, planning a pregnancy, or breastfeeding, it is crucial to consult with your healthcare provider. Regular monitoring and follow-up visits are advised to ensure the medication's effectiveness and to manage any potential side effects. You should not take Glatiramer acetate if you are allergic to mannitol or if you have had a severe allergic reaction to any component of the drug. Before starting the medication, inform your doctor if you have a history of heart disease, as Glatiramer acetate may cause chest pain or palpitations. It's also important to let your healthcare provider know if you have any other medical conditions, especially those affecting your immune system. Side effects: All medications can have side effects, and Glatiramer acetate is no exception. Some individuals might experience mild to moderate injection site reactions, such as pain, redness, swelling, or a lump at the injection site. Additionally, some patients may experience a post-injection reaction that includes flushing, chest pain, palpitations, anxiety, and difficulty breathing. These symptoms usually resolve on their own within a few minutes. Other common side effects include nausea, joint pain, weakness, sweating, and rash. If you experience any unusual or severe symptoms, it is important to consult your doctor. More serious side effects, though rare, can include severe allergic reactions characterized by hives, difficulty breathing, and swelling of the face, lips, tongue, or throat. Seek immediate medical attention if you experience any of these symptoms. It is also important to monitor for any signs of infection, as Glatiramer acetate can affect the immune system. Symptoms of infection can include fever, chills, sore throat, and flu-like symptoms. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Glatiramer acetate might interact with other medications. It is crucial to inform your doctor about all medications, supplements, and herbal products you are currently taking to avoid any adverse interactions. Although no specific drug interactions are known with Glatiramer acetate, it is always best to provide a full list of your current medications to your healthcare provider. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Glatiramer acetate. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Glatiramer acetate is administered by subcutaneous injection. The recommended dose for adults with relapsing forms of MS is 20 mg injected once daily or 40 mg injected 3 times a week, with at least 48 hours between doses. It is important to rotate injection sites to avoid skin problems. Always ensure you are taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on Glatiramer acetate, it is advisable to follow your doctor's instructions regarding injection techniques and site rotation to prevent skin reactions. Avoid injecting into areas where the skin is irritated, bruised, or damaged. As with many medications, it is recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for Glatiramer acetate. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It is always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Glatiramer acetate. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.